Ladies and gentlemen, esteemed guests, honorable speakers, we are in the second day of military medical web exhibition and the last session, last webinar. In this session, we have two distinguished guests. The first guest from Mrs. Burçak Çabuk, Head of CBRN Department, Ministry of Defense, Republic of Turkey. CBRN is very critical subject, and nowadays chemical, biological, radiological, nuclear defense, and we will learn and we will follow, listen, experience of Turkish Defense Ministry. Welcome to our webinar, Ms. Burçak Çabuk.
Hi again.
Thank you so much, and we are ready to listen. The floor is yours.
Thank you very much, sir. Good afternoon, ladies and gentlemen. My name is Burçak Çabuk, and I am the head of CBRN Defense Department at Turkish MOD. Today, I would like to talk about health logistics system of MOD, and I have a I am so sorry.
I think you have a presentation.
Yes, yeah, I have a presentation, and
okay. Yes.
Can you see it now?
Not now, but I think it will start. Yes, now we can see clearly.
Okay.
I see the cell. I think this is COVID-19.
Yeah, that's true.
Our headache. Yes.
Yes, sir. Now we can begin. I think in
Please.
general. To support military health units at all levels with an effective, efficient, economical, timely and continuous approach, the aim of the Turkish military medical logistics system is to identify, coordinate and plan the health supply needs of military health services, to coordinate and plan all logistics activities of affiliated associations and institutions, to supply healthcare materials within the domestic capabilities, and if that is not possible to produce these materials within Turkish armed forces via research and development capabilities, to supply from abroad if these materials cannot be produced with national efforts. You know that we have a center, Turkish Ministry of National Defense set up a center, COMER, to coordinate and manage the fight against COVID-19 in the armed forces in coordination.
Burçak Hanım, çok pardon bölüyorum. Şu an sunumunuzu biz çok küçük bir şekilde görüyoruz. Ekran paylaşımı kısmının altında küçük bir ok var. Ona tıklayıp tam ekranı... Tamamdır. Çok teşekkürler.
Now we see clearly the presentation of Mrs. Burçak Çabuk. So there was a little technical issue. Now we can continue. Now we see clearly your presentation. You can continue. Thank you so much.
Thank you very much. Turkish Ministry of National Defense set up a center, COMER, to coordinate and manage the fight against COVID-19 in the armed forces in coordination with the Ministry of Health. In general, the center follows all the COVID-19 developments and best practices in the world, monitor the current situation of the staff affected by the outbreak and the measures taken at the application level, make risk assessments related to the epidemic to make medical plans. And I also have a duty in the center. My duty is COVID-19 detection and diagnosis, decontamination, collective protection against COVID-19. And we have some products, the measures taken against COVID-19 by MOD. Military Pharmaceutical Directorate and clothing factories have started to produce protective healthcare products, including masks, coveralls, and disinfectant. Within the scope of a plan, COVID-19 rapid diagnostic tests, disinfectant, mask, and protective clothing are distributed to the institutions within the body of MOD and to the nations in need. You can see Sahra portable ventilator. I will give information about Mechanical and Chemical Corporation and MOD Pharmaceutical Factory Directorate, the institutions, those take activity duty in defense against COVID-19, the military medical logistics systems of MOD, and we have an informational video of Mechanical and Chemical Corporation. You can see it now. Sorry.
It's okay. I think your presentation will continue as far as I understand.
Yeah, yes, sir. Since COVID-19 reached the Republic of Turkey, Mechanical and Chemical Corporation, charged with the task of designing, developing, and producing complex defense and security systems, has added another highlight to its capacity by creating a domestic and national product called Sahra, a portable ventilator that aims to support the health systems of Turkey and other countries seeking help. And contacted by other Turkish institutions and organizations, including the National Defense Ministry, that are directly or indirectly involved in the fight against COVID-19 pandemic, Mechanical and Chemical Corporation has accelerated its works towards building facilities essential for the production of Sahra. I think you can see the, can you see my screen, sir?
At the moment, I only see yourself and your background, but I don't see your presentation at the moment. But a couple of minutes ago, we saw the Sahra portable ventilator.
Okay.
Yes, now I see your presentation, the products of MKE.
Okay.
MKE.
And the other products designed and produced by Mechanical and Chemical Corporation are safely goggles and face shields. They are made to fit all faces types with adjustable head strap and 100% vision clarity with anti-fog feature. Now the other products you can see, the other products designed and produced by Mechanical and Chemical Corporation are protective coverall and masks. And there is an informational video about CBM masks of Mechanical and Chemical Corporation now.
I think your presentation will continue.
Yes, sir, but I can't do this screen. Can you see the screen again?
Yes, now we see clearly.
Okay, sir. Because of pandemic, we began a TÜBİTAK project with TÜBİTAK Marmara Research Center and MOD Pharmaceutical Factory Directorate, and you know the drug hydroxychloroquine sulfate, I know, and hydroxychloroquine is a drug used for the prevention and treatment of certain types of malaria. Hydroxychloroquine tablet is known to prevent serious tissue damage by inhibiting the COVID-19 in lung tissue. Hydroxychloroquine sulfate tablet is included in the treatment of COVID-19 algorithm of Turkish Ministry of Health. So this project has two phases. One of them is synthesis of hydroxychloroquine sulfate, and the other one is the production of tablets. And we have some informational videos about TÜBİTAK Marmara Research Center and Pharmaceutical Factory Directorate. If it is possible, we will begin it now. And MOD Pharmaceutical Factory Directorate works with the mission of producing army-type medicines, CBRN medicines, bandits, and disinfectant. And we have another information video about MOD Pharmaceutical Factory.
I think we don't see the video at the moment. Is it possible to try again? This video? Yeah, I think it will work now. Yes.
Can you see it?
Yes, now we see it.
نتحدث عن العلاقات.
Sir, thank you very much. And I think you can see now my screen again. Sorry.
Have you finalized your presentation?
You can see my email address on the screen. If you have any questions, you can always write to my email.
Yes. Burçak.çabuk.at. Can you see again, if it's possible? Can you go back again?
Of course, sir.
For the participants, maybe would like to take a note.
Yeah.
Burçak.çabuk@msb. What was it? Government TR? Was it government.tr?
Yeah,
am I right?
Yeah, that's true, sir.
Okay.
Can you see it now?
At the moment, I don't see it, but I can tell it by my memory. As far as I remember, it was burçak.çabuk@msb.government.tr. gov.tr.
Thank you for listening to me, and have a good afternoon again. I hope we can see each other again. Thank you very much, sir.
I really appreciate you showed us CBRN capabilities of Turkish Ministry of National Defense, which was very important and impressive. Actually, by the way, Turkish Ministry of Defense has delivered very critical medical devices and units to many countries, more than maybe 100 countries, in collaboration with other Turkish ministries. And as far as we know, and you also mentioned about the showed us very important products, those are mostly locally produced products and devices, including portable ventilator and some other systems. I really appreciate your attendance, your participation. Thank you very much. Best wishes and kind regards also to the ministry and the minister.
Thank you, sir. Thank you.
Thank you very much. Ladies and gentlemen, esteemed guests, now we continue. And from Ankara, now we go to another important capital in Balkans, a very important country, Serbia. Now, with this panel, with this session, let's say, Mr. Vladan Radostojevic will be with us. He is the Chief of Department of Preventive Medicine at the Serbian Military Medical Corps headquarters, Serbian Ministry of Defense in Belgrade. So, due to some technical difficulties, he recorded a video instead of a live connection. So, we would like to show this video pre-recorded during the day. So, now we are ready to show this video.
Hi to everybody. I'm Vladan Radosavljevic. I came from Belgrade, from Serbia, work at the Military Medical Academy in Belgrade. I am MD, PhD, and in epidemiology, and also I am a professor at the Military Academy in Belgrade in biodefense. I will talk of a couple of recent events, this pandemic of COVID-19. As we could see, almost every country was unprepared for this pandemic. First of all, there was a big shortage of personal protective equipment, like gloves, like masks for the faces, like scaphanders, and like goggles, as spectacles, and also with a shortage with disinfectants. Preferably antiviral disinfectants. So each country should be prepared with this protective equipment: gloves, goggles, gloves, masks and scaphanders and disinfectants, preferably antiviral disinfectants. Also, there are specific anti-epidemic measures, and I divided them into 3 groups. First is vaccine against any biological agent. As we can see from this pandemic, it is necessary 1 year to produce vaccine and to be appropriately tested and licensed. But we should improve and to make faster vaccines against other diseases like endemic diseases, deadly diseases in Asia and in Africa, like, as I said, monkeypox, like Ebola, etc. Also, we have to apply so-called primordial measures of prevention. I described them in my book, Defense Against Bioterrorism, 2 years ago. Primordial prevention means to eliminate the focuses of such diseases, or to stop suicidal terrorists to be infected, to stop them before coming into focuses, or to leave focuses and to come in Europe, USA, and similar. After vaccines, the second group are of anti-epidemic measures are so-called serums. There are 2 types of serums. First type is human sera. Human sera could be produced only by recovered persons. It means a person who was infected and recovered, and after that from the blood of that person to be extracted antibodies against that bioagent. But that is very expensive product, and could be produced at least several months after the first man or patient recovery. The second type of sera are animal sera. Animal sera are getting from the animals, preferably from horses, because horses are big animals and they produce a big amount of antibodies, and I'm very wondered, and I'm very pity that this time nobody produced animal antibodies or animal sera. There were some attempts with to use antibodies from animals, llama from South America, and some other attempts, but nothing practical. So for the future, we should be prepared to have on stockpiles animal sera for the first aid. It is very, very necessary. And the third group of the anti-epidemic measures are drugs. There are two groups of drugs. First group are general drugs like antibiotics, preferably azithromycin and other antibiotics with wide spectrum of efficiency, and also antipyretics, analgetics. But another group are specific drugs, antiviral drugs, virucidal or virostatic drugs, if something like that really exists. For example, now many scientists carry on clinical studies to see which drugs are efficacy against COVID-19. But until now, we don't have the drug for which we can really say that is it. It really works. And that is a big problem. We have antibiotics, but we don't have antiviral drugs. Eventual discovery of antiviral drugs is equal to discovery of antibiotics. So it is not easy, and it will be probably a long way until that. It is very necessary to produce enough amounts of tests. I mean, two types of tests. First are PCR tests, polymerase chain reaction tests. In this case of pandemic, they are used for diagnosis of infected persons. Typically in majority of countries was lackness of enough PCR tests. Also, all PCR tests are not equal. In some tests, it is possible to be laboratory personnel to be infected with virus, but with another test, which are much better, when we put a virus on the into the substrate, a virus immediately will be inactivated, and there is no danger to be personnel infected. I think the Turkish got one plane from United States with such tests, and that they have real experience with such tests. I think such tests are called Gene Express or something like that. I cannot remember exactly. And it is very important to be tested as many as possible people. Also, the second type of testing is so-called ELISA testing, ELISA or ELISA testing. With such testing, we prove antibodies against viruses. For example, in this pandemic of coronaviruses, there are two types of antibodies which we can prove with ELISA. First, IgM, and if we find IgM antibodies in any person, that means such person is just infected and should be sent on PCR testing, and after that isolated and probably cured. But if we find IgG antibodies, that means such person was in contact with any kind of contact, like patient, like inapparent or latent patient in contact with the COVID-19 virus, and now is immune person. So it is very important to have enough such tests to test as many as people, because on that way we can get estimation what % of our population is immune against the bioagent, for example, COVID-19. So such tests should be produced in big amounts, in millions. Also, I will tell now about primary prevention. Primordial prevention I described for endemic diseases, which are focused in some parts of Africa or Asia, but also there are very dangerous microbes present in our countries. For example, tularemia, viral hemorrhagic fevers. Those are agents, bioagents from the group A. It is because all bioagents are divided into the 3 groups or 4. I divided them in 4 groups, but according to CDC Atlanta, there are 3 groups: A group, the most dangerous, B group, and C group. And I added emerging agents as the 4th groups. Tularemia and hemorrhagic fevers, in which is included also Ebola and variola vera, are agents from the group A. From the group A, that means the most dangerous agents, and tularemia and so-called mouse fever are present in Serbia, in my country, and also in Turkish, in your country, is present, on the whole Balkan is present, and in many other parts of the world. So, according to those bioagents, we should to apply so-called primary prevention. So, what means primary prevention? It means to monitor on the focuses and reservoirs of the of such diseases. Focuses means regions. For example, south of Serbia is endemic region for hemorrhagic fever, mouse hemorrhagic fever, and tularemia. So we should monitor on that area, and if diagnose any case, then immediately apply anti-epidemic measures. It is the same in every country. To monitor on already existing. Oh, sorry. Do you see me? Yeah. To monitor on already existing bioagents, and immediately to apply anti-epidemic measures. Also, I will tell something about methodology methodologies to make differentiation between outbreaks, because there are 4 types of outbreaks, natural outbreak, something, some new or emerging agent which caused the outbreak, accidental outbreak, and intentional outbreak. I and my colleague, Professor Belevich, made one methodology for differentiation of outbreaks, and we applied that on Escherichia coli outbreak in Germany in 2011. And we proved that the outbreak was not natural, as was first proclaimed by EFSA, European Food Safety Agency, and Robert Koch Institute for Rome, Berlin. We proved that it was accidental, and the vegetables was contaminated on the farm in Germany where it was produced. Also, there is another method, so-called Bruno-Finke method, German method. It was applied also, but now is improved by Australian scientists. And also they gave to us very, very interesting views and aspects and data that MERS outbreaks in 2015 years occurred and lasts until now, is not natural, but probably is intentional or accidental, and I believe in their proofs. Also, there is a very, very big disputing about this pandemic. Is it accidental or natural? But now it has extremely political dimensions, and I do not to talk about that. We scientists could talk about that when everything finished, then just to prove by 1, 2, 3 methods, and then conclude on scientific evidences.
Yes, as you mentioned, there are also question marks and unknown points of this COVID-19, the origin of this virus. We will continue to discuss, but thank you very much, Mr. Vladan Radosevich. You are the chief of the Department of Preventive Medicine at the Serbian Military Medical Corps headquarters in Serbian Ministry of Defense. You shared us very important medical and biological information about the outbreaks in general, and especially COVID-19 issue. So in this last 2 days, in our military medical web exhibition, we mostly talked about military healthcare industries and opportunities. Yesterday and today also we talked bioterrorism attacks, safety and security policies with our participants. And medical forces power, we also talked with our international guests from Kosovo to Serbia, from the United States, Bangladesh, Ankara, Turkey, Cyprus, and Pakistan, and some other countries. I really appreciate your participation, and I enjoyed very much to moderate in this last 2 days of this military medical web exhibition. By the way, meetings, business contacts, and business communications will continue today. We are about to finish our webinars, online programs, but B2G, business to government meetings and contacts and the programs will continue throughout the day. I would like to thank for kind contributions and for all speakers and participants. I hope we can see and we can meet in another exhibition, webinars or seminars. Have a great day, good afternoon again, and good night, because we have all participants from different countries and different geographies. I would like to share my best wishes and kind regards. Bye-bye.